Greetings from the World Health Organization in Geneva, where I am heavily involved in coordinating the international response to the outbreak of Ebola virus disease in several West African countries. The work you will be doing during this symposium, the issues and ideas you will debate are absolutely essential. I believe the world and its leaders are finally ready to recognize the vital role played by health systems research. What does the Ebola outbreak, that has been making headlines for months, tell us about the state of the world at large? What does it tell world leaders and the citizens who elect them about the state and status of public health? One thing is now vividly clear for everyone to see in the headlines and on their TV screens. Decades of neglect of fundamental health infrastructures mean that a shock, like an extreme weather event, a conflict, or a disease run wild, can bring a fragile country to its knees. Better health is a nation-building strategy. Without fundamental public health infrastructures in place, no country is stable. No society is secure. No resilience exists to withstand the shocks that our 21st century world is delivering with ever greater frequency and force. You cannot build health systems up during a crisis. Instead, they collapse. The fact that no fundamental public health infrastructures were in place in Guinea, Liberia, and Sierra Leone is what allowed the virus to spiral out of control. As the world suddenly sees, nearly everything is missing. Inadequate numbers of staff, hospitals overflowing or shut down entirely, not enough personal protective equipment or training in its proper use, little understanding of measures for infection prevention and control, big discrepancies between the quality of care in public and private facilities, few incentives to seek health care early, as the disease has no vaccine or cure. To meet the needs of affected communities, health officials and their partners need context-specific evidence about the most appropriate and effective mechanisms for delivering essential care. You will be touching on these issues in the coming days. As we all know, access alone is not a sufficient marker of adequate health care provision. Health systems must be people-centered. They must respond to the needs of people who receive services and not just the needs of those who deliver. Your research enumerates the many reasons why. Here is one of the few things that I'm glad to see as the number of Ebola cases continues to rise exponentially. When presidents and prime ministers in non-affected countries make statements about Ebola, they rightly attribute the outbreak's unprecedented spread and severity to the, let me quote, failure to put basic public health infrastructures in place. End of quote. Research will help the international community correct this failure. Perhaps messages about the importance of health systems, so forcefully articulated in your previous meetings and so well backed up by your evidence, have begun to sink in. It is high time they did. I wish you a most productive meeting. Thank you.